Gender inequity directly affects health outcomes and causes health inequality for women and girls in areas such as sexual and reproductive health, mortality rates, and sexual assault and violence. Issues impacting on health inequality include gendered roles, cultural norms, power imbalances, poverty, and a lack of access to health information and care. The United Nations Convention on the Elimination of All Forms of Violence Against Women aims to stop discrimination and specifically identifies women's right to health. Bangladesh, India, and Pakistan have all ratified this convention and other international and regional human rights treaties recognising women's human rights and their right to health. However, as our case studies illustrate, women and girls in these countries continue to suffer gender-based inequality and disadvantage, which often has dire consequences for health outcomes. In India, the constitution legislates against discrimination on the basis of gender, violence towards women, and has outlawed practices such as rape, sexual harassment, dowry-related homicide, and child marriage. However, cultural bias and social discrimination are pervasive and have resulted in a vast gender imbalance. Socio-cultural issues impacting on women's human rights include a preference for boys and neglect of girls, acceptance of sexual abuse and violence towards women, and a pervasive culture of impunity towards those guilty of crimes. This is coupled with low levels of political representation and high rates of illiteracy for women. In Bangladesh, Indigenous women and girls lack human rights and have much worse health outcomes than their counterparts. They experience much higher mortality rates, poorer access to healthcare and education, lower rates of skilled birth attendance, and experience much higher rates of gender-targeted violence. Although Bangladesh has harsh punishments for perpetrators of violence, Indigenous women often do not report offences to police or medical personnel due to social discrimination and the provision of limited, if any, assistance and support to victims. However, in response to these human rights violations, Indigenous women have created their own movements to provide support for victims and advocate for equity and women's rights. In Pakistan, armed conflict in the region has resulted in damage and disruption to the health system, including infrastructure, facilities, funding, and provision of care. This has had a serious impact on human rights and health outcomes, especially for women. Under the Taliban, female community health workers were subjected to threats, violence, and death. This led to mass resignations and near collapse of community health programs providing care to women, resulting in rises in maternal deaths and infectious diseases. Recently, there has been progress in Pakistan towards the recognition of women's human rights and their right to health through the passing of legislation aimed at the prevention of violence and harassment towards women. Governments in all three countries have been working to address gender inequalities through legislation and policies. However, there are significant implementation issues, and addressing the underlying socio-cultural factors related to a male-dominated and patriarchal society is a major challenge. Attaining equality and empowerment of women will require effectively addressing international human rights and women's rights conventions, including effective implementation of national laws, legislation and policy, and the continued advocacy for women's rights and capacity strengthening. It will require the provision of health information and significant improvements in investment in access to and utilisation of healthcare and services, including primary healthcare. This needs to include women being provided the freedom to make informed choices and be effectively engaged in decisions regarding their health. This will require fundamental social transformation, including major changes in norms and perceptions, the redistribution of power, and increased economic opportunities for women. The improvement of the status of women is not only essential for health, equity, and human rights, but also for economic growth, poverty alleviation, and human resource development in these countries.